All right, welcome everybody to our second session. Today we're talking about degenerative conditions and joint protection principles. My name is Hannah Yinke. I'm an occupational therapy student from UTMB, and later we'll have Kelly coming in to talk about joint protection principles. All right, so our table of contents, we're talking about bone health, osteopenia and osteoporosis, joint prevention, joint protection techniques, and then we'll have some information on our survey. So for degenerative conditions, we're going to talk about bone health first. So our bones are really important because they support us and they allow us to move. They protect our brain, our heart, lungs, and our internal organs from injury. So it's important to take care of our bones, and we're going to talk about some ways to do that. So one way to do that is calcium. Calcium is needed to help build and maintain the strength of our bones. Calcium is especially important for females because females typically have an increased risk of developing a lone bone mass over time. So with that being said, how much calcium is needed every day? For women between 19 and 50, 1,000 milligrams of calcium are needed per day. That changes when we get to 51. So 51 and older, we need about 1,200 milligrams. For men, it's different. For between 19 and 70, we have 1,000 milligrams of calcium per day. And then when we hit 71 and older, 1,200. So we can see that for women especially, we have to start taking more calcium earlier on than men. So for our calcium shopping list, here are some different food items I'll be talking about that we should be including into our diet to help with calcium and prevent calcium deficiency. So with calcium deficiency, this can reduce our bone strength and lead to osteopenia and/or osteoporosis. So it's important to include foods that are rich in calcium and vitamin D in our diet to help. Some examples of foods that are rich in calcium include dairy products, milk, yogurt, cheese, soy products, and also lactose-free products. If you have like Lactaid, that's a good option too. In addition to milk, you can do like plant-based milk. So you can do soy milk, oat milk, almond milk. Those are good options. For vegetables, we would need soybeans like edamame, spinach, kale, broccoli, and collard greens. And then products that have added calcium in them include most breakfast cereals, tofu, and 100% orange juice that has fortified concentrate that has vitamin D3. That's an important vitamin to include. And then plant-based milks, as I mentioned earlier. So when we're looking at our nutrition facts label, we want to look at the daily value of calcium and vitamin D. So here's an example on the right-hand side of a nutrition facts label. And what we see is that if your product has at least 20% of calcium, for example, that's an excellent source of calcium for that product. If it has at least 10%, then that's good. That's still good. So be looking at your nutrition facts to find what foods are rich in calcium and vitamin D for your diet. An example, a cup of fat-free milk has 23% daily value for calcium. And that's really good. That's actually in the excellent category, as well as a cup of orange juice that has 27% daily value for calcium. Again, excellent. So with that being said, a calcium-rich diet is best, but if you're unable to eat enough foods with calcium, just in your routine, then talk to your doctor about potentially adding supplements into your diet. So taking a multivitamin with calcium or just a calcium pill. See what works best for you. I know we all have different diets. So our vitamin D shopping list looks like this. For dairy products, again, an important aspect for vitamin D, we have milk, soy milk, plant-based milks again, and yogurt. So as you can see, dairy products have both calcium and vitamin D. So that's a good food item to have in your diet, as well as protein, especially fish. So our salmon, tuna, sardines, tilapia, those are good items to include on a regular basis. And then for fruits and vegetables, raw mushrooms, excellent source of vitamin D. And then again, that 100% orange juice. So with that also being said, ways to improve our bone health include physical activity. So exercising helps us to maintain our strength, our balance and coordination, and prevent falls, which is big when it comes to osteoporosis. We'll talk about that later. So some weight-bearing activities to include in your exercise routine include walking, hiking, jogging, and dancing. And there's some new research out there about walking that we'll talk about later. As well as including resistance exercises. So using free weights, medicine balls, suspension equipment, those are all activities to include. So the combination of weight-bearing activities and resistance exercises are helpful in increasing your bone mineral density. So now we're going to talk about osteopenia and osteoporosis. With osteopenia, the definition looks like this. So decrease in bone mineral density, but the values are not low enough to meet the diagnostic criteria for osteoporosis. Osteopenia affects 34 million Americans and is 4 times more prevalent in females. With that being said, 54% of postmenopausal women are osteopenic. So that's an important fact to know. That's a lot. That's a large percent. This might be something new to note too. Our peak bone mass is actually achieved at age 30. So that 30 to 35 range, that's our peak bone mass. So what's going to happen, just a natural part of aging, is that we see bone loss. That's really the primary cause of osteopenia and osteoporosis. With osteoporosis, this is the most common bone disease that is diagnosed. And what happens here is the rate of bone reabsorption increases and the rate of bone formation decreases. So we're experiencing this weakening of bone tissue, bone structure, and strength overall. The bone itself is becoming porous, which increases your risk of fractures, especially after a fall. It's mostly going to impact your hands, your wrists, your lumbar spine, and your hips. So with that being said, a history and physical is very important to have and to talk to your doctor about regularly. So discussing your family history with your primary care physician is especially important because genetics is going to dictate 80% of your bone mineralization levels. So if it runs in your family, talk to your doctor early on. Physical exams for individuals without risk factors are recommended for females approaching menopause or by 65 at the latest, and for males 70 years of age. So if you don't have a family history of osteoporosis, then at least by 65 for women and 70 for men, you should be checking out with your doctor how your bone levels look. Okay, for a physical exam, what's included is a screening by a dual X-ray absorptiometry DXA scan. This scan is going to look at your bones and check out how porous are they. They're going to scan your lumbar spine, your hip, and your wrist. And there's certain scores that you get after this scan. If your T-score is between -1 and -2.5, that's in the category of osteopenia. If your T-score is below -2.5, that's the osteoporosis scale. So this information your doctor will talk to you about following your screening, but I'm just giving you the information right now so you have it ahead of time and you're aware. Some risk factors that can increase your risk for osteoporosis include sex. So females, I mentioned earlier, are 4 times more likely to be diagnosed with low bone mineral density. Size, that's a big factor too. And then that's why females are diagnosed more because of thin, fragile bones. We're just smaller bones compared to men on average. Age, again, that peak bone mass density is at 30 to 35. And so after that, we have a gradual loss. So that's just a natural part of aging. Race, typically white women and Asian women and white males are diagnosed more compared to African Americans, and then Hispanics. Family history, a big part of it, we talked about that earlier. 80% of your genetics are going to determine your bone levels. Your lifestyle, are you drinking a lot? Are you smoking? Physical activity levels, what does it look like? So smoking and heavy alcohol consumption also play a role in your bone mineral density. Changes in hormones, low estrogen in women and low testosterone in men. And then I talked about this earlier, but diet. So again, low vitamin D, low calcium. There's also other medical conditions, especially conditions affecting your thyroid, like hypothyroidism or hyperthyroidism. Some gastrointestinal issues can also lead to bone density, and then cancer. Those are the more common conditions that can lead to bone mineral density. So with osteoporosis in the United States, around 10 million Americans have osteoporosis. And according to a CDC 2021 update, 18.8% of women 50 years of age and older with osteoporosis at lumbar spine and the femur, compared to men who had 4.2% of men of 50 and older had osteoporosis at lumbar spine and femur. So it shows you the difference, 18.8% compared to 4. That's a huge jump. And also here's another fact to share. Not the greatest fact, but 1 out of 2 women and up to 1 out of 4 men will break a bone due to osteoporosis. And that is because osteoporosis is known as the silent disease. And we'll talk about that more soon. So right now, actually. So osteoporosis is known as a silent disease because you typically are not aware that you have it until you fall and you have a fracture. So that's why you don't know about it, because you fall and then you break your wrist or your hip, and then your doctor tells you, hey, you have low bone mineral density. So it's something that if we talk to our doctors early on, then we're more aware of it. But often you're not diagnosed until you have that fracture happen. So what are some other signs and symptoms to be aware of? A low energy fracture, we kind of just talked about that, but a low energy fracture, this is where you are from standard height, your height, and you fall over and you have a fracture. That's known as a low energy fracture compared to a forceful fracture. If you're like jumping off of elevated surfaces and then you have a fracture, that's a high energy fracture. But for low energy fracture, that's a sign and symptom of osteoporosis. Kyphosis, this rounding of our thoracic spine, that's another sign and symptom, as well as height loss, joint and bone pain, and then sudden back pain. So for prevention, how do we keep our bones strong and prevent osteoporosis? Calcium-rich foods, vitamin D-rich foods, weight-bearing exercise, we talked about those earlier, as well as resistance training, a healthy lifestyle, so quitting smoking, limited alcohol consumption, and then definitely important, routine physical exams and a wellness checkups with your doctor. So here's some research about the benefits of exercise when it comes to low bone mineral density. A combination of aerobic exercise and resistance training is more effective in decreasing that bone reabsorption and increasing bone formation, especially in postmenopausal women. All right, that's great. And earlier I talked about the importance of walking, but there's more research out there that says that wearing a weighted vest during walking or aerobic training is more effective when it comes to bone formation than just walking without weights. So I found that interesting and I wanted to share that with y'all because I didn't know about that. So if you are using weights, that has shown to be more effective in increasing your bone formation and also improving your balance, which is helpful because again, if we fall, that's where a fracture can happen if we have low bone mineral density. Exercise is also effective in preventing fall-induced injuries. So research has shown that if you exercise and you include aerobic exercise, dynamic balance exercises, and resistance training for at least 6 months into your workout routine, that will reduce the need for medical attention following a fall. Great. I will say there is more research that is needed to be done in order to determine the relationship between exercise and bone mineral density and increasing bone mineral density. There is some research out there, but it's not significant enough to really say this exercise is going to help. So I think it's a combination of going to your doctor, doing your exercise, lifestyle, nutrition. These are all big factors that play a role, not just one single exercise. Here are some examples of exercises to be including if you do have osteoporosis. And so that way we're keeping it safe, and we'll talk about some contraindications later. But here are some exercises. We have posture exercises, so stretching out our pecs. This is also going to help flatten our upper back and prevent that kyphosis from happening. Our hip and back strengthening, by strengthening our hamstrings and our glutes, that's going to help, especially when it comes to preventing falls. Also strengthening our hip abductors, same thing, those monster walks are helpful in improving your balance. Doing toe raises and heel raises, helpful strengthening our lower legs and helping balance as well. And again, like wall sits, squats, that's gonna help with keeping our back straight and helping our legs and our core to stay really strong. So as I mentioned, there are some contraindications with exercise. So for individuals with osteoporosis, they have a greater risk of bone fractures, right? So with that, the falling should be avoided. Forward flexion of the spine. So doing sit-ups and crunches as well as toe touches should be avoided, as well as sudden forceful movements and twisting at the spine. A little twist is okay, but not forceful twists that are going to potentially lead to a stress fracture in our spine. We want to avoid that. And as always, consult your doctor prior to engaging in physical activity. So for our conclusion, the big thing is just to maintain a healthy lifestyle in order to reduce your risk of osteopenia and osteoporosis. So having that calcium-rich and vitamin D-rich diet, regular physical activity, routine physical exams from your primary care physician, especially if it runs in your family, with exercise, combining the aerobics, dynamic balance, and resistance training, which TriFitness already does. So you're getting that in your daily workouts here. And with that, also strengthen your lower extremity to help prevent falls. That's a big thing. And we'll talk about fall prevention next week. And incorporating stretching to help improve your posture. So don't forget about stretching, it's very important. And lastly, here are our references for this first portion. And next, we're going to have Kelly, who's going to come in and talk about joint protection principles. All right, there we go.
All right, guys, like Hannah had mentioned, my name is Kelly, and I'm also from UTMB, and now I'm going to talk to you about joint protection principles and why it's important and how we can prevent falls that way. So for joint protection, the definition is of a joint. So we want to know about this just because it's the basic and foundation to prevent this from happening. So joints are where part of the body moves. So where two bones meet, that's the movement that happens there. And so that's what a joint is. And so for the techniques are self-management techniques. And we want to do these techniques because that's going to help reduce pain, joint stress, inflammation, and reducing the risk of deformity. And so in OT, what we work on is using different assistive devices and different movement patterns. So that way the affected joint is no longer affected and you can perform your everyday activities more optimally. So why should we take action? It's important that when you start to feel your joints swollen, painful, warm, or even stiff, it's important to take action because we don't want arthritis to occur and we don't want other degenerative conditions to occur. And then it's also important when you notice that your ligaments have been overstretched, resulting in an unstable joint. So it's important to prevent the progressive deterioration of joints and the surrounding tissues. So like I had mentioned, whenever the joints are moving, we want to make sure that we follow these joint protection techniques. So that way we're not overstretching it, we're not overstretching the tendons, ligaments, which is going to cause damage to the joint. And whenever that happens, then you have pain, different joint deformities, you're misusing them, and that can all impact how you complete your activities of daily living, how you're functioning, and it can also inhibit the things that are meaningful to you and you're no longer doing them. So what we do in OT is we focus on reducing joint pain, decreasing joint damage and the deformity, and decreasing the wear and tear on the joint by following these different joint principle techniques. So now for joint prevention. Okay, so it's always important to respect pain. Pain is a warning sign that your body's telling you something's not right. So you always want to listen to the pain, and anytime you're experiencing pain, stop what you're doing. And you can take a note and change the way that you're doing something. If you notice something isn't working, change it. And then also the duration of the activity. If you notice that you were doing something for about an hour and afterwards it was hurting your arms, it was hurting, your legs or something, then maybe instead of doing an hour, try 45 minutes and see how you feel after that. If that's too much, then try 30 and just kind of go from there and see what you're able to tolerate without feeling pain. So always know that pain is a warning sign that something's not right. And so you don't want to do that. Rest. It's always important to rest your joints. Whenever it's pain, whenever you're feeling a lot of pain, whenever it's swollen, that's what inflammation is. You always want to make sure you rest it. And how can you rest it? You can limit the movement that you're giving that joint. So for example, if your elbow, if it's really hurting, try not to use your elbow so much. You can use your other one. Just limit the movement that you're doing until you're no longer feeling pain. Maintain a good position. Whenever we're up and moving and doing all these different things, make sure that you're doing the movement correctly so that way you're not hurting the joints. Sometimes we get put in all these awkward positions and we're trying over here and trying to grab things here. And, sometimes we're holding so many things that we're not using our body correctly. Make sure that you're always maintaining a good position. And you can always support your joints with pillows or different kinds of armrests. Good body mechanics. So you always want to use the strongest and largest joints. A great example is whenever you're carrying grocery bags, sometimes we're using our fingers. Our fingers are really small. They have small muscles, small joints, and everything. Why would we be why would we be putting so much effort and stress onto our little fingers whenever we have elbows and shoulders? So whenever you're carrying grocery bags, instead of trying to grab everything at one time and putting so much stress on our fingers, try using your elbow or your shoulder to have the grocery bags there. Maintain good posture, like always. Avoid repetitive movements. If you notice that you're knitting, or if you're trying to use a hammer and you're constantly doing those repetitive movements, and then afterwards you're in a lot of pain, try to limit the amount of times that you're experiencing that movement. And also that kind of goes into the next one, avoid activities that require a static hold. If you're doing something and you're constantly having to hold your hand, you're putting so much effort into your joints, and that's not good. You want to limit the amount of activities that you're doing constantly. And then just change the positions you're doing things. If you notice that you were holding something like this, okay, let's switch hands, or let's try to add a different handle so that way you're not holding the item that you were holding in the same position. Maintain strength and range of motion. That's something that you can do by coming here and exercising regularly. So it's important that you maintain the strength in your muscles, because the stronger your muscles are, the more support your joints are going to have, and it's going to reduce the stress on it. And whenever you're not moving, that can lead to joint contractures. And so what that is whenever your joints are no longer moving, remember you want your joints to move, that allows your body to move. And whenever you're not moving something, like let's say it's hurting and you're holding your arm right here, it's going to lead to a joint contracture. Those joints are no longer moving, they're going to stay stiff and you're not going to be able to move. So making sure that even though you do experience pain, you're still moving it a little bit, so that way it doesn't get stiff and tight and not move anymore. Using adaptive equipment. So you can also modify the equipment you're using to make it easier on your joints. So for example, building up a handle, putting some kind of glove or padded handles, non-slip grip over a handle, that's going to be easier for you to grasp. If your joints are really swollen and you notice it's harder to open your hand and grab objects, by building up the handle, you don't need as much range of motion and it's easier for you to grab these items. Also extending the handle. I know like the Yeti cups, now they have handles on them, and that makes it easier to reach. Using long handles, like long handled sponge or even the reachers, those are really good because you're not having to reach so much. And whenever you have longer handles, it's easier to hold. And then always remember that whenever you're shopping for a new tool, whether it's in your kitchen, whether it's in your restroom or anywhere, try to make sure that it's lightweight, so it's easier to hold and it's comfortable. Oftentimes we forget about the comfort and we just go for looks, but the comfort really matters on how you use your body. And the lighter it is, the easier it's going to be to pick up objects. So now we'll go into some different techniques and a little fun fact about what we're going to do for the joints. So respect pains. I definitely kind of want you to think about it in your head before you kind of think about the do's and don'ts, and just think of some ways that you can respect pain. So it's important for do's to distinguish between pain and discomfort. Is it painful, or are you just not feeling comfortable because you haven't done this motion, so you don't really know what the motion's supposed to feel like? And then if the pain lasts for more than 1 to 2 hours, how can you modify the activity? It's important that if you're still feeling pain after doing an activity and you want to continue that, try to modify the way that you do it and change it so that way you don't feel pain anymore. And then, like I previously mentioned, always stop and rest when you're experiencing pain. So what we don't want you to do is continue an activity if you're experiencing any kind of pain. Like I mentioned, pain is a warning factor, and it's your body's way of telling you that something's not right. So now think about some ways that you can do things for avoiding positions of deformity. So you always want to stand with your weight evenly distributed between your body, so that way your body is not having to compensate and do all these awkward movements. So you want to have both of your weight with your 2 feet side by side, and working with your hands flat and avoiding prolonged flexed position. So whenever you're having to constantly flex your fingers, flex your arms, your knees, all that stuff, it's actually really bad for your body. And so you want to make sure you're maintaining your joints flat and you're not constantly having them flex just like this. So what you don't want to do is curl up or prop yourself on a bed. It's actually not good for us. It's okay to do these things a little bit at a time, but doing it for prolonged periods of time repetitively, it can be bad on our joints. It's actually not good to use a tight grip to grab objects. You're using so much force on these muscles and it's hurting the muscle and the joints. Same thing with squeezing. And it's okay to squeeze like, stress balls, that's totally fine. But doing it constantly or like squeezing heavy objects, using tight grips to, pull things apart, that's actually not good. So this is just, it's okay if you do it for a little bit, but doing it repetitively, longer periods of time, it's bad for our joints. So I recommend, standing on a stool to reach overhead so that way it's easier and you're not constantly having to overly stress your joints because that can make them loose and overstretch them. Reposition yourself so that you're closer to the object. Make it easier on yourself. The closer that you are, it's going to be easier to grab, easier to hold. And then sitting to do things. And then using neutral spine, so making sure, you have a good position whenever you're sitting, lying down, and completing different tasks. So what we don't want you to do is extend your arms to reach for objects in an awkward spot. So that way you're hurting your back. You only have one back, so we want to make sure that we do take care of it. And then kneeling down to grab objects. We don't want to do that. You always want to squat and use those bigger muscles that you have. And then using large and strong joints. So what we do want to do is use two hands when possible. So for example, when you're reading a book or you're holding a pen, use two hands instead of one. As you're using two hands, you're distributing that weight evenly, which is better for our joints. Carrying a shoulder purse. So like I had mentioned, using that whenever you grocery shop, that's better than holding all the bags with one hand, or at least trying to put the groceries like on your elbow or your shoulder. And then lifting objects from underneath using your wrists and your forearms, that's better than using your fingers. And then lift objects with your knees bent, so in a squatting position and having your back straight. And then you always want to push heavy objects. Pulling is putting so much stress and tear on your small finger muscles. We don't want to do that. So you always want to push as much as you can. And push with the open palm of your forearm right there. So what we don't want to do is hold a purse in your hand. Now for purses, they even have the backpacks, which we totally recommend. It's the best way because we know like as females, we carry a lot of things in our purse. And so sometimes they're pretty heavy. So having a backpack or a crossbody is going to be better on your hands and your joints for sure. So like I mentioned previously, don't use a tight grip to grab objects and squeeze them. And actually pinching and gripping the sides of objects is pretty bad. So we want to limit the amount of time that we're doing it. And they also have different electric can openers, which is really good because you're not having to put so much stress and tear on your joints because opening cans of jars is actually really, really bad for us. So if you can find different electric adaptive ways to open it, and Amazon is a great resource. They do have electric can openers. I recommend using them. We don't want to pull heavy objects like I previously mentioned, and you don't want to push things with your fingers. Use your whole hand if you're able to. And here are some different adaptations. So like I had mentioned with the backpack, you don't want to use it with one strap. You want to do two, so that way all the weight is evenly distributed on your back. Whenever you're at the grocery store, use the grocery cart, so that way you're not having to carry everything in awkward positions. And then instead of using the grocery bags with your fingers, you can use a tote or a crossbody or something to put your groceries there. And then these pictures on the bottoms are an example of like how to build up a different utensil so that way it's easier to grab. And then making the levers longer. So you can see with this key, using keys is really bad because you're only using your fingers. So if you have a longer handle, it's easier to twist. And then someone reading a book using just two hands to support it instead of one. And this was my reference. And then we really would love to hear your feedback. Since this is for school, we kind of just want to see what y'all are thinking, if we're making it easier for y'all to understand and what we can do better and facilitate what y'all want to learn about. But thank you so much. We appreciate y'all listening to us and watching these videos. All right.